This is a cross-section, coronal section of the abdomen that is located most posteriorly. In the midline, you can see the vertebral column. These are the lumbar vertebrae, and these are the thoracic vertebrae above. Inside the vertebral canal, look at the spinal cord. The spinal cord terminates at the level of L1 vertebra, and the vertebral canal downwards below L1 is filled with the Cauda equina. So this is L1, L2, L3, L4, and L5, which articulates with the sacrum. The sacrum itself articulates with the ilium. This is the ilium, and the site of the articulation between the sacrum and the ilium is at the sacro-iliac joint. This is a synovial joint of the plane variety with an undulating surface. And you can see here the articular surfaces of bones are covered with hyaline cartilage. Above, the liver, the visceral surface of the liver is related to the kidney and suprarenal gland. On the left side, the left dome of the diaphragm is related to the spleen, and the spleen itself is related to the left kidney, where you can see a very small piece here of the left kidney. On the posterior abdominal wall, this muscle is the Quadratus lumborum muscle. Note the quadrangular shape of the muscle. Psoas major is located more medially and in a more anterior section, so it is not apparent in this section. Lateral to Quadratus lumborum muscle, these muscle fibers belong to the transverse abdominis muscle. Within the pelvis, the posterior wall of the pelvis is formed by the sacrum, and the sacrum here gives attachment to piriformis muscle. Also, in the pelvis, you can see a loop of small intestine, mainly the ilium. There is a loop here of large intestine, which is the sigmoid colon. And see here, this is the Recto-sigmoid junction. So this is the rectum here. The lower part of the rectum is the rectal ampulla, the distended lower part. Within the rectum, you can see the transverse rectal folds, the folds of Houston. This is one of these folds. There are 3 folds within the rectum. The rectum gives rise to the anal canal, where here you can see only parts of the external anal sphincter,